The following is an article from Health Magazine, Fall 2024 edition, published by the Southwest Utah Public Health Foundation.
Feeling the Heat by Lindsay Chandler, health educator. Narrated by Lindsay Chandler. The desert regions of Southwest Utah have over 300 days of sunshine a year, and the allure of outdoor recreation can be irresistible. However, with high temperatures, especially during the summer, heat injury can become a concern. Without immediate treatment, heat exhaustion can lead to heat stroke, a life-threatening condition. Fortunately, both are preventable. Here's your guide to enjoying the great outdoors with heat safety in mind. Selecting a heat-smart destination. Look for destinations with milder climates or higher altitudes to escape the scorching heat. Southwest Utah has many mountain retreats where breezy forests can offer relief from sweltering temperatures. Consider visiting indoor attractions such as museums, galleries, or theaters where you can cool off while enjoying cultural experiences. Infants and children younger than 4, as well as adults older than 65, are at a higher risk of heat exhaustion. The body's ability to regulate temperature isn't fully developed in children. For older adults, illness, medications, and other factors can affect the body's ability to control temperature. Timing your activities wisely. Plan outdoor activities during the cooler parts of the day, such as early morning or late afternoon, and avoid strenuous activities during peak heat hours, typically between 10 a.m. and 4 p.m. When planning on a day or time, make sure to look at the National Weather Service Heat Risk website. NWS Heat Risk is an experimental color numeric-based index that provides a forecast risk of heat-related impacts to occur over a 24-hour period. Heat risk takes into consideration how unusual the heat is for the time of the year, how long the temperatures will last, including both daytime and nighttime temperatures, and if those temperatures pose an elevated risk of heat-related impacts based on data from the CDC found at wpc.ncep.noaa.gov/heat risk. Packing essentials for heat safety. When choosing what to wear, keep in mind that sunburn affects your body's ability to cool itself. Start by protecting yourself from the sun's harmful UV rays by bringing wide-brimmed hats, sunglasses, and a broad-spectrum sunscreen with an SPF of at least 15. Apply sunscreen generously and reapply every 2 hours, more often if you're swimming or sweating. Pack lightweight, breathable clothing in light colors to reflect sunlight and to keep you cool. Avoid wearing too much clothing or tight-fitting clothes as it won't allow your body to cool properly. Wearing moisture-wicking fabrics that dry too quickly can minimize discomfort from sweat and help prevent heat exhaustion that could potentially lead to heat stroke. It is also essential to carry a refillable water bottle and stay hydrated throughout the day. Consider adding an electrolyte drink mix to your water to replenish minerals lost through sweating from strenuous activity. Embracing water-based activities. Take advantage of water-based activities to stay cool and refreshed. Whether it's swimming, kayaking, or paddleboarding, these activities offer a fun way to beat the heat while exploring your destination. Find a nearby water park, one of our many reservoirs, miles of riverbanks, or a public pool where you can enjoy aquatic adventures with friends and family. With careful planning and consideration, you can enjoy unforgettable experiences while staying safe and cool. Heat exhaustion may start suddenly or progress over time, especially with long periods of exercise. If you think you have heat exhaustion, stop all activity and rest, move to a cooler place, drink cool water or sports drinks. Contact your doctor if your symptoms get worse or they don't improve within 1 hour. If you're with someone who has heat exhaustion, seek immediate medical help if they become confused or distressed, lose consciousness, or are unable to drink. If their core body temperature reaches 104 degrees Fahrenheit or 40 degrees Celsius or higher, they need immediate cooling and urgent medical attention. Heat stroke requires emergency treatment. Untreated heat stroke can quickly damage your brain, heart, kidneys, and muscles. The longer treatment is delayed, the more the damage worsens, increasing your risk of serious complications or possibly death. If you think a person may be experiencing heat stroke, seek immediate medical help. Call 911 or your local emergency services number. Take immediate action to cool the overheated person while waiting for emergency treatment. Get the person into shade or indoors, remove excess clothing, lower the person's body temperature using any available method, immerse them in water, spray them with a garden hose, fan them while misting, or apply ice packs or cold wet towels to their head, neck, armpits, and groin.
If this episode kept you alert and informed, mission accomplished.